Let's talk about personality disorders using a module from the University of Kentucky by Christina and Thomas. To define what a personality disorder is, identify the 5 domains of personality: neuroticism, extroversion, openness, agreeableness, and conscientiousness. Identify the 6 prominent personality disorders: borderline personality disorder, antisocial, schizotypal, avoidant, obsessive compulsive, and narcissistic. Everybody has a personality, how they think, feel, behave, and relate to others. There are signs of personality traits in childhood, but they become more evident once we reach adulthood. Personality traits involve our sense of self, what we value, how we think and feel about things, what we like to do, and what we are like throughout most of our day, throughout much of our lives. This table looks at the polarity between the 5 domains of model of personality, allowing someone to better understand how their personality presents. Neurotic versus emotional stability: fearful, apprehensive, angry, bitter, pessimistic, embarrassed, helpless, fragile, versus emotional stability: relaxed, unconcerned, cool, even-tempered, optimistic, self-assured, restrained, clear-thinking, fearless. Extroverted versus introverted: affectionate, attached, sociable, outgoing, dominant, forceful, vigorous, energetic, active, reckless, daring. Versus introversion: cool, aloof, indifferent, withdrawn, isolated, unassuming, quiet, resigned, passive, cautious. Openness versus closedness: unconventionality versus conventionality. Openness and unconventionality: dreamer, unrealistic, imaginative, aesthetic, self-aware, eccentric, strange, odd, peculiar, creative, pessimistic, broad-minded. Enclosed or conventionality: practical, concrete, uninvolved, no aesthetic interest, constricted, unaware, routine, predictable, habitual, stubborn, pragmatic, rigid, traditional, inflexible. Agreeableness versus antagonism: being agreeable, gullible, naive, trusting, confiding, honest, sacrificial, giving, docile, cooperative, meek, humble, soft, empathetic. Or antagonism: skeptical, cynical, suspicious, paranoid, manipulative, deceptive, stingy, selfish, greedy, exploitative, oppositional, combative, aggressive, confident, boastful, arrogant, tough, callous, ruthless. Conscientiousness versus disinhibition. Conscientiousness: perfectionistic, efficient, ordered, methodical, organized, rigid, reliable, dependable, workaholic, ambitious, devoted, cautious, reflective. Disinhibition: lax, negligent, haphazard, disorganized, sloppy, casual, undependable, unethical, aimless, hedonistic, negligent, hasty, careless, rash. When personality traits result in significant distress, social impairment, or occupational impairment in someone's life, they can be considered a personality disorder. Part of the diagnosis for personality disorders is a collection of personality traits. Some of the DSM-5 personality disorders are confined largely to traits within one of the basic domains of personality. For example, obsessive compulsive personality disorder is largely a disorder of maladaptive conscientiousness, too much conscientiousness, workaholism, perfectionism, ruminating. Schizoid personality disorder is traits of introversion, withdrawn, cold, isolated, anhedonic. Borderline personality disorder is largely a disorder of neuroticism, traits of emotional instability, vulnerability, feeling overwhelmed, rageful, depressive, and self-destructive. Histrionic personality disorder is largely a disorder of maladaptive extroversion, including traits of attention-seeking, seductiveness, melodramatic emotionality, and strong attachment needs. Because each personality disorder represents a constellation of personality traits, the syndrome will involve a complex interaction of an array of different neurobiological vulnerabilities and dispositions with a variety of environmental psychosocial events. For example, with antisocial personality disorder, generally considered to be a result of a lack of interaction of genetic disposition for low anxiousness, aggressiveness, impulsivity, or callousness. Somebody with a genetic predisposition for those behavioral traits combined with their environment. Tough environment, inconsistent parenting, poor parental role giving, and poor peer support. A person who could have the genetic predisposition for low anxiousness, high aggressiveness, impulsivity, and callousness, if they are in an environment that shapes that behavior and models it into a constructive outlet, it doesn't manifest as a personality disorder. Borderline personality disorder is generally considered to be the result of an interaction between the genetic disposition to negative affectivity, the genetic predisposition to feel neurotic, to feel anxious, to feel worried, to feel insecure, to feel mistrustful. And the personality disorder presents when that is in combination with a malevolent, abusive, and or invalidating family environment.